What are the options for CF fertility preservation? If you're living with cystic fibrosis and thinking about having children someday, you might wonder what options are available to preserve your fertility. Cystic fibrosis can impact reproductive health differently for men and women, especially because of how the disease affects the body systems involved in reproduction. Understanding these options can help you plan ahead and discuss your choices with your healthcare team. For men with cystic fibrosis, fertility is almost always affected. About 98% of men with CF have a condition called congenital bilateral absence of the vas deferens, which means the tubes that carry sperm from the testes are missing or blocked. This causes obstructive azoospermia, or no sperm in the semen. This condition isn't reversed by CF treatments like CFTR modulators. So, natural conception is usually not possible for most men with CF. The common approach is assisted reproductive technology, or ART. This involves retrieving sperm directly from the testes or epididymis through minor surgical procedures, such as needle aspiration or surgical extraction. The retrieved sperm can then be used in vitro fertilization or intrauterine insemination with a partner's eggs. Freezing sperm before any treatments that might further impair fertility is also an option, especially if sperm are present in the ejaculate. This way, men can preserve their fertility early on and have options for future family building. For women with cystic fibrosis, fertility is generally less directly affected by the disease itself. Many women with CF can conceive naturally. However, treatments like lung transplantation and the use of certain medications, such as immunosuppressants or chemotherapy drugs, can harm ovarian function and reduce fertility. Because of this, early discussions about fertility preservation are important. Women have several options, including egg or oocyte cryopreservation. This involves stimulating the ovaries with hormones to produce multiple eggs, retrieving those eggs, and then freezing them for later use. Embryo cryopreservation is similar but involves fertilizing the eggs with sperm before freezing, creating embryos that can be stored for future pregnancies. Ovarian tissue freezing is an experimental option that involves removing and freezing ovarian tissue, which can be useful for women who need to start treatment quickly or for prepubertal girls who are not yet producing mature eggs. Some women consider ovarian suppression with medications like gonadotropin-releasing hormone agonists during chemotherapy to protect ovarian function, but the evidence on its effectiveness is mixed. Surgical procedures, such as moving ovaries out of radiation fields, can also help protect ovarian health during certain treatments. Because cystic fibrosis treatments and their impact on fertility can vary widely, early consultation with reproductive specialists is key. Planning ahead allows for personalized strategies to preserve fertility before starting treatments that could damage reproductive organs. This proactive approach supports your family building goals and ensures you have options available when you're ready. In summary, fertility preservation for people with cystic fibrosis involves sperm retrieval and freezing for men, and egg or embryo freezing, ovarian tissue preservation, or protective measures during treatment for women. The best approach depends on individual health, treatment plans, and personal goals. Remember, discussing these options early with your healthcare team is essential. They can help you understand the risks, benefits, and timing to make informed decisions about your future family plans. Always seek personalized medical advice to find the best path for you.